Hello everyone, my name is Meisya. I'm a peer mentor for GRRSP, and today we'll be talking about how to write an abstract. So, writing an abstract is pretty much skill that is expected from you throughout this program and even after this program, and it's very crucial for you, especially when you want to submit it to a conference, for example. So, to me, an abstract is basically like a trailer of a manuscript, or when you want to submit it to a conference, it's sort of like a sample of your product. In this case, it's your research or it's your systematic review. So it should be concise enough, it should be appealing enough, and it should be like the representation of your work, in this case, your research. So let's go to what is an abstract. So basically, an abstract is a short structured summary describing the contents of a scientific paper. But in the case of systematic review, especially when you submit it to a conference, an abstract at least should be enable the reviewers to, review the validity, applicability, and easy identifications of the abstract in the electronic searching. And this is done by the keywords. So when you see an abstract, like at the bottom of an abstract, you will see the keywords that basically represent the content of the abstract. And usually an abstract is not more than 400 words, but each conference has their own guidelines for it, so you should follow the guideline of a conference. Now, an abstract should be kept as brief as possible without sacrificing the important content. So the abstract should not be too detailed, or it should be like not including all the important points. Now, basically, in the abstract, you have basically the content that summarizes the method, the result, and the conclusion of an abstract. Now, usually in an abstract, the references, tables, or any sort of like figures might not be included, especially when we're talking about conference abstracts. So, therefore, sometimes you only have to include the words of like 300 words, concise words of an abstract. Now, here, I hope you guys can see the example of basically an abstract from one of the faculty in GRRSP, Dr. Pate. So this is his work on the impact of diabetes mellitus on the mortality of pulmonary hypertension. I hope you guys can see the screen. So in the screen, basically, we can see there is four main components of an abstract, which is followed by clinical implication in this case. So first we have the purpose, or like the introduction, the methods, the results, and the conclusions. But basically, but sometimes the conference would require you to add something like clinical implications. For example, CHEST conference would like ask you to write some of the clinical implications of your systematic review. So don't get too overwhelmed by looking at this slide, because we'll break it down of the key components of the abstract. So the very first thing that when people looking at the abstract is the title. So the title of the systematic review, especially when you're doing systematic review with the meta-analysis, it should identify the report of the study. So whether it was systematic review alone or with meta-analysis. So for example, in this case, we have the impact of diabetes mellitus on mortality in pulmonary hypertension, systematic review, and meta-analysis. Now, by looking at this title, I can see, like, at least I can appreciate the PICO of the research topic. It was the impact of diabetes mellitus on mortality in pulmonary hypertension. So the population was pulmonary hypertension, and it was that intervention was diabetes mellitus, and basically looking at the mortality in this research topic. And for social media study, the title of the social media study at least should include the hashtag that was analyzed and the platform where the hashtag was analyzed. So in this case, if you guys can see the first example here, we have the Breathing Together, a global hashtag analysis of hashtag lung health on platform X. So it mentioned the name of the hashtag and the platform where it was analyzed. So in this case, it was on TikTok, so on platform X. So for example, if you want to do a social media study on TikTok, for example, then you mention the name of the hashtag. In this case, it was hashtag nursetalk on TikTok. Or if you perform another social media study on Instagram or YouTube, then you mention on YouTube, on Instagram, or like TikTok, for example, in this case. So title should be concise and should be appealing enough. Now, moving on to the introduction, background, or even purpose section of an abstract, like the first component of an abstract. So it should be 1 or 2 sentences, sometimes 3 sentences, basically should explain the context or elaborate the purpose of the review. And the primary objective of the review should be described in a single sentence and should be precise enough to describe the objective of the main text of the review. And they should match. So for example, if your objective was to, let's say, analyze the impact or the mortality in diabetes mellitus, it should match the main text of the review. Now, the style or like the sort of like style of sentence, when you want to describe the primary objective, it should be in an active sentence. So for example, in this case, to assess the effects of what? Let's say antiarrhythmics, or to assess the effects of, let's say, any other drug, antihypertensive drugs. And then you mentioned the intervention with the comparison and mention the patient population or the setting in this case. So it could be pulmonary hypertension in ICU settings or in hospital settings or in inpatient settings. So sort of like concise enough to describe your PICA questions overall. Now, let's look at an example of the systematic review abstract from the previous abstract that we saw. So here, they basically have described the pulmonary hypertension, like the general overview. So what was the pulmonary hypertension? And then they describe the knowledge gap in a very brief sentences. So basically, if you guys can see, it says that independently associated multiple comorbidities, the impact of diabetes mellitus on mortality in patients with pulmonary hypertension remains uncertain. And then they proceed by talking about what they did to fix the knowledge gap. So in 3 sentences, they basically describe their whole introduction section. Now, for social media study, first you start by talking about what is Twitter, how significant is your hashtag in the Twitter community, and what is going on in the Twitter community related to your hashtag, and then what you did to sort of like bring the imprint of this hashtag. So in this case, if you guys can see on the hashtag ID Twitter, they mentioned that they evaluate the demographic data on hashtag ID Twitter. So sort of like analyzing the global impact of the hashtag. So that was for the introduction section. Now for the method section. So in systematic review, especially when it's met with meta-analysis, the method section in the whole manuscript usually very long, very detailed, but in the abstract, it should be concise enough to describe the eligibility criteria. So what was your inclusion, exclusion criteria? What type of study did you include? What type of databases that you include, and search dates? So you just list the order of the databases. So what that databases you analyze. For example, we analyze PubMed, Cochrane, Medline, Embase, and so on for the past 10 years. That was the search dates. And then you mentioned the risk of bias assessment, if there was any risk of bias assessment. So it could be quotas assessment, probas assessment, any type of assessment if you have done any assessment. And talking about methods of the systematic review, usually we have search criteria, but in this case, in the abstract, it should not be listed because otherwise it's going to be too long, too detailed, and probably not necessarily enough. And you mentioned the selection criteria, so mention the type of study. Did you include RCT, cohort studies, or what type of study did you include? You mentioned like the very brief, the intervention, comparison, and the patient populations. And lastly, mention about how you collect and analyze the data. So how many articles did you get in the first place, and then how many later on, how many articles did you include, and then you mentioned how many articles you include in systematic review and how many articles you included in meta-analysis, if let's say the analysis was done. Now again, let's take an example from the Dr. Spateh work here. So here, this abstract has done excellent job on describing their method section. So they describe the list of databases. So they describe PubMed, Embase, and then how many study they identify in the first place. So that was 50 relevant study published within the past 10 years for detailed review. And then they mention what type of study did they include. So it was RCT and cohort study. And what did they do? They compare survival between patients with diabetes mellitus versus those without diabetes mellitus in the context of pulmonary hypertension. So you can basically see their PICA question and what type of study they include. And then they mention how many studies they included at the end. So there were 7 studies were eligible for inclusion in the meta-analysis. And they also mentioned the registration number in Prospero. Now, that was it for the systematic review. Now, for social media study, the method section basically at least has to describe what type of tool you use to analyze the hashtag. So in this case, we can appreciate that they use Fedica analytic tool for over 2 years. So they mentioned that the timeline of the analysis and the number of and what type of like metrics they analyze. So usually in social media study, we analyze engagement metrics like number of posts, likes, views, and demographic data, or like top countries or top influencers. Like should be very brief and very concise. Now, talking about the results section, like the main, basically the core point of the manuscript and even in your abstract. So in systematic review or with the meta-analysis, the results section should include the included study, let's say, and then you mentioned the number and type of included study, participants, and relevant characteristic of the studies. And then you talk about the outcome. So let's say if you've done meta-analysis, usually we have primary and secondary outcomes. So you mentioned the primary outcomes and mentioned the benefit and harm. So for example, for brief example, if you compare antihypertensive drugs, like that was the intervention with control. So you mentioned the mean difference in systolic reduction, for example, and how much the mean difference. Then you mentioned the confidence interval with the p-value. So we can see where it was statistically significant. And then you mentioned the harms if the analysis was done in this case. So harm is something like the adverse event. So when you do drugs, sometimes there is like syncope, headache in this case. So you mention again the number with the confidence interval with the p-value. So because this is relevant in the clinical setting, so that's why in the results section it should include the point. So as always, if the meta-analysis was done, always include the summary measures with the confidence interval and mention the description of effects. So again, it's about the meta-analysis, but there's something called effect sizes. So you mentioned whether the intervention favored the control or intervention favored the interventions or favored the other group. So you mentioned the odds ratio or relative risk or the mean difference. And then you talk about the confidence interval with p-value. So you should see if it was significant or not significant. So here again, we have the very nice example of the meta-analysis result here. So they mentioned the total number of patients populations here, we can see. So the number of total populations. And then they mentioned how many in the intervention group or suffer from diabetes mellitus and how many did not. And then they described the effect size basically, which was in odds ratio, which was actually significantly higher in patients with diabetes mellitus compared in the control group. And later on, they also describe something about heterogeneity, which was significant in their study. Therefore, they mentioned that. And then they proceed by talking that they did sensitivity analysis to actually sort of like handle this high heterogeneity. And then they describe the result of the sensitivity analysis. So in the meta-analysis results, something that is relevant, something that is clinically relevant, or something that is important, you mention that in the results section of an abstract. And always remember to include the confidence interval and the p-value. So that was it for the results section for the meta-analysis, the systematic review. Now moving on to the social media results. So for the social media results, basically pretty simple. Also, like you just mentioned the number of overall impressions of the hashtag analysis study. You mentioned the engagement metrics, how many engagement, how many likes, how many number of posts and number of views, like very concise in active sentences. And then you talk about the top countries, co-occurring hashtag, and top influencers. So it should include the main important or key metrics that you analyze in the first place. So that was it for the results section for both systematic review and the social media study. Now, moving on to the conclusion. So conclusion should be very succinct and so very concise and drawn directly from the findings of the review. So it should reflect the main results. So any opinion, any future direction, any suggestion should not be included in the conclusions. So for example, here from the same sample abstract, we have the meta-analysis, which included approximately the number of the patient, revealed that the presence of diabetes mellitus was associated with increased odds of mortality compared to non-diabetic patients. So the conclusion basically drawn directly from the main findings or the main results. So you guys see that it was just one sentence, as very brief, did not include any sort of like opinions or any sort of like suggestion. Now for the social media study, the conclusion should be something related to, did the analysis has like global impact, and what was the significance of the hashtag that was analyzed? Was it significant to that we use it as a tool for spreading awareness over certain diseases? So in this case, you guys can see that the hashtag heart health was actually significant in promoting cardiovascular health awareness, and it was a tool that has global impact in promoting awareness and actually reaches numerous countries and audiences. Now, last component of an abstract. So usually an abstract just consists of introduction, method, your result, and conclusions. But in this case, sometimes the conference might require you to add clinical implication, such as CHEST conference might require you to add the clinical implication. So in this case, you add something that is important in terms of like the clinical relevancy of your systematic review. So in this case, from Dr. Pate's work, so they describe the novelty of the study, and then they talk about how the diabetes mellitus is actually the common comorbidity associated with pulmonary hypertension. And then they mention the future directions of the study and actually potential for improvement treatment. So they highlighted that in the future, there should be more treatment related to pulmonary hypertension patients with diabetes mellitus. So they basically describing how the systematic review, basically the clinical implications of their topic or their systematic review. Now, lastly, about the funding and registration. So if there is any, you just add that point, and depending on the conferences, they might require you to add some funding or like registration number. Now, last point is the common mistakes. So common mistakes that people make when writing an abstract that is too long or too cluttered. It fills with irrelevant details because they just copy pasting it from the main body of an abstract, main body of the review. So instead, an abstract should be like original. It should be well structured enough and basically a summary that tells a clear story about your review, about your systematic review or with meta-analysis. And then you should always advise to follow the journal instructions or the conference guidelines. So in terms of like the phone number, the sizes, or if they require you to add subheadings or headings, you always follow that and avoid citation unless referring to seminal works by name. Also minimize sort of like abbreviation or overly complex language. So in the previous abstract, we saw that they use DM for diabetes mellitus and PH for pulmonary hypertension. So make sure that you mention the abbreviation in the introduction, and later on you can just use the abbreviation in method or like in the results section. Lastly, it's to follow the word limits of an abstract. So if it was 300, then use 300 words limits. Last mistake is using the wrong tenses. So usually in the method section, we always advise to use a past tense. So something that sounds like we analyze data from. And for conclusions, use the present tense. So the findings suggest instead of like the findings suggested. So yeah, thank you. That was the presentation on writing an abstract, and thank you for your attention.